My practice is in the North Shore of Chicago. It's kind of a hybrid of academia, meaning I teach residents and medical students. I do clinical work, so I'm treating patients pretty much all outpatient, pretty much musculoskeletal and lower back pain, neck pain, spine pain. And then I also am chairman of my group, so I have some management issues that I address as well. Originally, I was influenced by my brother to go into medicine. He's an ear, nose, and throat specialist. I wanted to do sports medicine, but when I went through the orthopedic rotation, the surgical aspect of it really was not appealing to me. So it was much more appealing to handle problems non-surgically. I felt I had a better relationship with patients when I did that, a longer-term relationship with patients when I did that. Well, it's more than a medical practice. I think most physicians, you associate MD with treating medical issues. And as I stated, it's not just that. It's relationships, it's improving patients' functions, it's being an advocate, but it's also treating their medical issues as well. A lot of education involved in terms of educating people as to what we do, educating the community in terms of dealing with disabilities. So I think we really wear a lot of hats in terms of the practices that we're in. Start to develop long-term relationships with your patients that you may not get in other practices, perhaps primary care, but not so much the other ones. I do have some patients where it's quick, we get them better quickly, and then they get back to doing what they want to do, and I don't see them again, which is okay as well. But I do value having the long-term relationships with the patients. We treat a vast array of patients. My practice is very boutique-ish, but the physicians in my practice, we treat all realms of health issues. And we focus more on the whole patient. We're not kind of focused on that disease state. We do clinical medical care, and so we try and improve their illness, but we also are functioning on their functional abilities, their abilities to get back to doing the things that they love in life, getting back to their families, so on and so forth. So Physiatry is more than just a typical medical practice in that we focus on many things, including getting patients to return to the activities that they love to do by themselves with their families. It's a more holistic approach, so we're not just focusing on the medical aspect of things, but also the functional aspect of things.